I greet you all and welcome you to SDA NMTC Alumni Health Promo. My name is Samuel, and our discussion for today is about benign prostatic hyperplasia. I repeat, benign prostatic hyperplasia, which is popularly known as, in short, it is also known as BPH. You can please drop your questions and then comments in the chat if any. Well, the prostate is a gland located below the urinary bladder in men and surrounds the urethra. Its main function is to produce the fluid that nourishes and transports sperm. The muscles of the prostate also ensure that the semen is forcefully pressed into the urethra and then expelled outwards during ejaculation. Now, let's talk about some risk factors of BPH. The main cause of benign prostatic hyperplasia is unknown, as some may refer to as idiopathic. But there are some predisposing factors or some precipitating factors that can contribute to the incidence of BPH. The number one factor is aging. Benign prostatic hyperplasia is more common the older you get and doesn't usually affect the young ones. I mean those who are younger than 40. As I said earlier, BPH mostly affects the aged. Alright, so number two, positive familial and genetic factors. That is talking about family history of BPH. For instance, if your dad or your brothers have the condition, you have a higher chance of getting it too. Then we have some lifestyle associated with obesity. That one too can contribute to one having BPH. Diabetes and hypertension is also a risk factor. For instance, if you use medications like beta blockers are antihypertensives. Or let me put it this way, it's a type of medication used to treat high blood pressure and migraines. You may be more likely to get BPH. How does one get BPH? Benign prostatic hyperplasia has a relationship with aging, as I mentioned earlier. At birth, the prostate is of a pea size until puberty. It gradually grows, and in the third decade of life, it rapidly develops to adult size. However, at age 40 to 45 years or older, BPH begins and continues to grow slowly until death. Well, we have some remodeled microenvironment interaction of causative factors that can lead to increased prostate volume. So we have cells and tissues that give structure to organs and then glands in the body, and those cells are also known as stromal cells. This can promote local inflammation and then cause altered cytokines. When I mean cytokines are neurotransmitters, or one may say signaling proteins that controls inflammation, or in short, cytokines are inflammatory mediators. With this process, there is an increase in oxygen demand of proliferating cells and local hypoxia in the inducement of angiogens and changes to fibroblasts, thereby resulting in functional and then phenotypic changes of fibroblasts to myoblasts. And I may say this is a transdifferentiation, right? So these are ways through which one can have BPH. Now let's look at some signs and symptoms of BPH that are very common in men. Patients, as I said earlier, is usually above 40 years. That is the third decade of life. So number one sign and symptom is frequency. I repeat, frequency. The meaning of frequency is having to pee a lot. That is peeing about 8 or more times a day. Yeah, that is frequency. It's a number one sign of BPH. We have urgency. That is feeling the urge to pee. Sometimes there will be dribbling when you finish peeing. Then there could be nocturia. Nocturia is waking up several times at night to pee. One may also have straining on micturition. When I mean micturition is a process or the process of passing out urine. So straining on micturition, that is, one may have a hard time starting a stream. There could be a weak or poor stream. So sometimes the urine stops and then starts again. There could also be intermittency. There could be intermittency in the passage of urine. Then one sign and symptom that is more also common in people with BPH is feeling of incomplete bladder emptying. So sometimes, for instance, after urinating, you still feel like you want to urinate again. You feel like all the urine hasn't come out, and there is still some urine in the bladder. Yeah, there could also be some recurrent UTI, that is urinary tract infections. For instance, there could be cystitis, that is inflammation of the bladder, that is the urinary bladder. I mean, then there could be epididymocarditis, as we all know. There could also be septicemia. Then there could be hematuria, but I will just classify that as a more complication of BPH. So now we are getting to the complication of this disease. When we talk of complications, that is medical or surgical conditions that necessitate the need for surgery. So one, we have urine retention, and that can be acute or chronic. And that one could be an indication for surgery. There could be hematuria. As I said earlier, hematuria is passing out of, that is blood in urine. That is hematuria. That is a more complication of BPH. There could also be progressive renal failure. Sometimes the patient may be required to do a renal functioning test or prostate specific antigen, that is PSA. Yeah, so sometimes the person's kidneys could fail due to BPH. There could also be recurrent urinary tract infections, as I said earlier, that is cystitis, and then other kind of UTI or maybe septicemia. Then hydroureter, and then hydronephrosis. Well, someone may ask, are there things I can do to prevent it? The short answer is no. That is, for most men, the prostate gland is just going to grow, and you see, and as it continues growing, it may lead to BPH. Lifestyle modifications or sometimes lifestyle changes can't prevent benign prostatic hyperplasia, but they may still be good for your prostate. Why do I say this? Because we all know that when one exercises a lot or when you exercise regularly, it strengthens the pelvic floor muscles, thereby tightening your prostate or the muscles of the prostate gland. And we also know that exercise is also good, because obesity increases the risk of developing BP. So when you exercise, you lose a lot of fat. One should limit red meat and fatty foods. So I would encourage that we all choose more plant protein food over animal protein food, because they have been proven to reduce the incidence of prostate diseases. You could also lower the amount of fluids you drink or you take in before you go to bed, because we all know that when you take in much fluid before going to bed, you may pee a lot at night, and it can cause nocturia. But it still helps to know when you would want to see a doctor, what makes you more likely to get it, and then how you can keep the symptoms at bay. I think the doctor will help you know all of this. Sometimes the doctor will educate you to avoid or limit how you use decongestant and then antihistamines during course and then allergic outbreaks, as they tighten the muscles that control urine flow, making it more difficult to urinate. You can also limit how much caffeine and then alcohol you take, because we all know that excessive intake of alcohol or caffeine makes you pee more and can irritate your urinary bladder. So friends, this brings us to the end of our discussion on the topic benign prostatic hyperplasia. And don't forget, as I said earlier, to drop your questions and comments in the chat if any. I'm hopeful that we will meet some other time. Thank you so much for your time. Goodbye.